This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
We have two questions submitted live. The first one's quite long, so I'm going to read it out to you from Christie, and then I'll come back to the second one after you've answered this one. So Christie says, I'm with a public IVF clinic. I have PCOS and not ovulating. I did 2 rounds of IVF. First transfer was an empty sac. Second was a fail. Third egg collection, we did menopur. I'm not sure if I'm saying it right or it's misspelled.
That's the drug, Menopur. Yeah.
Menopur, and changed to long protocol. I responded much better and collected a high number of eggs and finally have embryos frozen. My third transfer ended up in a miscarriage. Didn't grow past 6 weeks and a slow heart. Do I need embryo testing? Is it an embryo issue?
Oh, it depends how old you are. I mean, if you've got lots of embryos, even at the age of 30, half of them are going to be genetically abnormal. So you could have just been unlucky so far.
Sorry, Prof. Christie just added another message saying I forgot to add above. I started young. I'm now 33.
Yeah. Okay. So half of the embryos that you produce are likely to be genetically abnormal, and therefore, even if they implant, the miscarriage is a likely outcome. So testing embryos, has an advantage in terms of determining which of those embryos are the ones that are unlikely to give you a miscarriage. By testing embryos, we reduce the miscarriage rate from a background of around about 15% down to 2 or 3%. So it doesn't necessarily exclude a miscarriage, it makes it highly unlikely. I'm slightly intrigued by their approach to your treatment, given that you've got PCOS. I'm not quite sure why they moved to the long down regulation protocol, because that does have some risks of hyperstimulation, which is probably why they froze all the embryos. I understand what they did. So yeah, when is PGT useful with the pre-implantation genetic diagnosis? When you've got lots of embryos, it certainly means you're moving more quickly to the ones that are most likely to give you a pregnancy. Ultimately, though, if their freezing protocol is a good one, you will get to the embryo that was genetically normal anyway. But there may be multiple cycles before you get there.
Prof, I've added your phone number here, which is 91384222, and your email address, m.chapman@unsw.edu.au, and the website livefertilitysydney.com.au.
Yep.
So the next question is from Jen, and she asks if there are support groups or counseling services for IVF patients.
Yeah, so every IVF clinic, as part of its accreditation, requires us to have a counsellor available for support during the cycle and after the cycle. So once you go through it, or when you're going through a cycle and things are getting hard, or if at the end of the day you're not pregnant and that's a devastating experience, as we all know it is, contacting that counsellor can be a useful support. In terms of support groups, I know that Pink Elephants has groups of IVF patients as well as miscarriage. That would be one course of action. And there is a patient support group called Access. They've become much less active recently, though, so I'm not sure how much support they would give you. And the other people to give support in a good IVF clinic, the nurses provide a substantial resource for talking about what went on and what to do next. And certainly at Life Fertility Sydney, we have an amazing group of nurses who fulfill that role as well as our counsellor.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.